Good morning and welcome. I am Dr. Peter Holmes, orthopedic surgeon, and I am host of your program, Ask the Doctor. My guest this morning is Dr. Michael Gurl. Dr. Gurl is a gastroenterologist. If you have any questions for Dr. Gurl in the future, two ways to reach us. You can reach us through the web at www.needfoundation.org or fax 696-9012. Well, reading an article about health expenditures in 2006 have now exceeded $2 trillion. They're talking about health expenditures are now 16% of what they call the gross domestic product, which means everything we make in the United States, about 16% has to do with keeping you healthy. Now, this is about a 6% jump from the year before. And they're talking about how it's going to go to about a 20% part of our GDP by the year 2020. Now, they're talking about it like this is a bad thing. 20% of our GDP is there to take care of your health. Well, we're talking about all your health. You know, you go to the drugstore and you see all these people buying things to take care of themselves, and it's a pretty healthy little business, and people are pretty healthy. What's more important, what else could you ask for than your health? So if we're spending a fifth of our GDP for health, so what? Now, part of the reason for the increase, of course, is simply because us baby boomers are now entering the time of life when we need a lot of health care. In other words, when I get to be 70, I need more health care than when I was 16. And there's a bunch of baby boomers now entering this envelope starting this year. We've had our first baby boomers go into this. Well, the reason they're trying to squish this down is they basically can't afford it. See, all the Medicare monies we put in for years is spent, so the money's not there. So it's going to have to come from present taxation of dollars to take care of a lot of us Medicare type of folks. So they're not implying that there's unnecessary procedures as these costs go up. They're not saying that at all. Matter of fact, what they're saying is that the number of procedures need to go down. See, the cost per procedures are actually going down, yet the costs are going up because there's more procedures, because there's more of us. So what they're actually saying to decrease healthcare expenditures is they have to decrease necessary procedures. Now, how can they go about doing this? One way, managed care. If they pay a managed care company X amount of dollars, the managed care company then can profit by decreasing procedures. Now, they're going to call it managing your care. I always wonder why they're called even healthcare institutions or insurance institutions, but the way they do it is through referral systems, decrease the referrals out and therefore not get it done. There's nobody that needs a total knee as an emergency. You can give them Advil or aspirin for a year, or you can get the knee replacement. Now, with managed care, you maybe tend to do one versus the other. The second thing is even those not on HMOs is to decrease reimbursements to physicians. Now, physicians make up a very small percentage of the healthcare dollar, but if you decrease the reimbursements to physicians, which they threatened to do this January, which they stopped till July, get back to that later, there'll be fewer physicians doing Medicare patients, and therefore fewer physicians doing necessary procedures. The third way, what they're doing now is they do not approve all known good medical procedures for Medicare patients. In other words, for example, some defibrillators that we can use for a 64-year-old not on Medicare for certain indications aren't, quote, indicated for Medicare patients, simply because they can't afford it. Bottom line is this: there's going to be a lot of pressure to push down costs, in my opinion, by decreasing the number of necessary procedures. So watch this. If you feel like you should be getting something, talk to your congressman. You paid for this with 45 years of labor through Medicare tax. These are my opinions. Any comments? Two ways to reach me: through the foundation at www.needfoundation.org or fax 696-9012 to ask the doctor.